Hello everyone, my name is Nicholas. I am from Amicus and this is Dr. Thomas from Resilienz Clinic.
Hello.
And we are here to actually talk a little bit about the most hot topic nowadays, which is actually vaping.
Yeah.
And this is going to be a really casual conversations about learning what this whole issue is about. We are here to share more with you. If you have any questions, you should be able to write down in the comments or to ask us any questions. We should just get down to the real topic, okay? So let's get us going. Dr. Thomas, what is this whole etomidate?
Etomidate.
That's right. Yes.
Well, etomidate is actually it's an anesthetic agent. It's a short-acting anesthetic agent that is used in medical settings in a hospital for induction of general anesthesia, for sedation, for use in surgical operations, right? So it's actually a poison. It's a very powerful, potent drug that is only licensed for use in approved settings, like in a hospital. So when used safely, of course, it has its uses to proceed with the medical procedure. But when it is used in an excessive manner or in an abuse manner, you never know how much you're taking in, right? You get intoxicated, you can get problems with overdose of the etomidate, or chronic use of this drug can lead to many physical and psychological problems.
Yeah, and I think the issue that we're hearing is that the users do not know that actually there's such a ingredient in the capsule, right, of the vape, right?
Yes.
I mean, how did this whole thing come about?
I think it started off, I think many years ago, there's such a thing called e-cigarettes, right? To replace the actual cigarettes, and was said to be safer option. You don't take in the thousands of chemicals in a cigarette. Well, but over time, the things are being added to the e-cigarette, and eventually evolved to be a vaping vaping device that comes in all sort of shape and colors. And well, we know that many years ago I was already doing a lot of addiction work, right? In a hospital, in my clinic, and you hear of things being added to different kind of chemicals, put together, and that can provide this powerful effect, right? So etomidate is just one of many things that are added inside. You used to have ketamine or so. They add into the vapor, and I've seen patients, many over the years, that they have different chemicals like ketamine, and recently etomidate added. This thing called the NPS, the new psychoactive substances, or NPS. Well, every day new ones are being invented or produced. So it's not unexpected that some kind of drug, and in this case etomidate, is being added to the vape, right, to enhance whatever effect they want.
So is there anything else we should know about etomidate besides being an anesthetic, right?
Okay, so etomidate is a drug that when you get into your body, it works on the brain system. Right? It works on a chemical system called the GABA, G-A-B-A. So GABA is actually a neurotransmitter, or the chemical messenger, right, that the nerve cell use to talk to one another. Right? So GABA has a inhibitory function, so it suppresses the nerve system, the nerve firing. So it essentially has a calm your nerves, right? Calming effect. So make you less stressed. You're less anxious. You're just basically calm. So etomidate is just one of many substances or drugs that can stimulate this GABA system. So common ones are like alcohol, sleeping pills, the benzodiazepines, and many others. So etomidate is one of them. So what etomidate does when you inhale into your body, right? It goes to the brain really fast. So it calms you down, right? It gives you that calming effect, gives you a state of euphoria, where you feel good. You have this state of strong feeling of well-being. and make you feel calm, relaxed. Well, these are the effects that people who use it want them. They use this to relieve whatever negative emotions or lousy feelings they have. Yeah.
And we see on videos recently, right? A few of the young people who actually take that, and parents are also quite worried, right?
Yeah.
So, can you explain a little bit about? I mean, if it hit us so fast in the brain, does it result in having those kind of like behaviors? Literally, like they're walking and then they're like topping over, and the parents are very worried about that. So days at home, and do they even know what they're doing?
Yeah, they don't even know what they're doing exactly.
That's the effect.
That's the effect. Well, so I talk about the good things, so-called good things, the euphoria, you know, the calm effect. But the flip side, the bad effects are so much more. You can experience psychotic symptoms, you know, hallucinations. You hear things, see things when they are not supposed to be there. Okay, you can have delusions, false beliefs. They are unshakable, so you strongly believe in it. You can have this experience this dissociation. You know, you feel high, you feel like you're floating out of your body.
Wow.
That reminds me of many years ago, you know, the glue sniffing epidemic. When you take it, you feel high, you feel like you're Superman, you can fly.
Wow.
Yeah. So and also aggressive, erratic behavior, you know, they become very, very aggressive, you outbursts of anger. And these are what scares the family members, the loved ones. Yeah. Self-harm behavior also very common because you're confused, you don't know what's going on. And Etomidate does that, you know, you just don't know what's going on. Your level of awareness of your surrounding, your environment, your situation is just reduced. And you your speech is slurred, you walk unsteadily, you know, you may do things that are risky and impulsive behavior, so doing dangerous actions because your judgment is also impaired when you're taking in all this Etomidate.
This recording is actually targeted at parents, and you alluded to actually the parents who are actually very scared about this whole situation and they probably don't even know what to do and what to look out for. You know, I mean, our clients that we are working with, the parents are also wondering how they can support their own children and their young adults. You know, even some of them, obviously, those that are also younger. You know, are there signs that we can actually look out for?
If you see your child or your loved ones having this sudden change in behavior, right? Like a change in their routine, they skip school, right? They neglect their responsibilities, you know, change in their sleeping patterns, or they just simply not themselves anymore, out of character, not your child that you always know. Okay? And you know, so these are some signs that you may want to suspect. It may not be just Etomidate or KPODS, it may be other drugs. There's so many other drugs out there, right? Yeah, but if you start to find, like some of my patients' parents, they come to me and say, hey, I found, you know, this vaping device at home. You know, I hidden here and there. You know, they are very worried, but they don't know what to do. They may remove them today. Tomorrow they appear again. Very easy to get them. So they are very helpless about what to do. But the first sign of trouble is when they find a child becoming not themselves anymore, just change in behavior.
Very stark difference in behavior, right?
Very stark difference in behavior.
Yeah, and this is one thing we need to highlight, right? It's not that you see certain change in behavior that automatically they are on like a vape, you know, and they're consuming certain laced drugs in their vapes, right? The clear sign would be that you know that you found something in their bag, in their room, that kind of thing, right? It's like vaping, right? Okay, then after that, because of that stark behavior and change, you know, then you want to be a little bit more careful and find out a little more curious to find out, right? But generally, young people, they have mood swings, and sometimes they're just quiet, they have very stark behavior change, right? But this is you don't want to immediately jump to the conclusion that, you know, this is actually drug related, right?
You're looking at sudden outbursts of behavior.
There you go, sudden outbursts. That's right.
You know, a child who is usually calm, you know, pleasant, suddenly become, you know, irritable. Right, get angry. And this is what drugs or Etomidate can do to the person.
And typically can be like manage the kind of behavior it was drug induced.
Well, I mean, yes, and firstly you have to ensure safety. So safety comes first, prioritize safety.
Means
if you see a child in this kind of likely drug-induced state, of course you have to quickly seek medical help.
Okay.
Yeah, because there may be some medical crisis going on in the body. For example, like etomidate can over time, right, cause some adrenal suppression or adrenal insufficiency. So adrenal glands, they produce a hormone, stress hormone called cortisol. So cortisol is very essential to our body. So it helps us to fight stress. So when you have a situation like fight or flight, you need the cortisol to help you to, fight this situation or run away, help you to think. It raise your blood sugar to give you energy to do all these things. So without cortisol, you can't fight stress. Your blood pressure goes down, you feel tired, you feel weak, just simply cannot function like normal anymore.
So we just want to let's find out a little bit, how fast does the drug hits the brain?
I would say very fast. You inhale, through the lung, it absorbs into the bloodstreams, it travels to the brain. All right. Of course, depending on the dosage, how much you inhale. So there'll be, to some extent, you experience that state of euphoria, right? The state of calmness, and you like the feeling. So it triggers the dopamine system, right? They reinforce this behavior to want to do it again, right? So you may want to try again because it gives you the effect that you want. So you want to do it again, and the more you do it, it reinforces this reward system, and eventually it may lead to addiction. Yeah.
So typical brain learning where you dabble with this drug, there is obviously the effect of making you more want to consume it,
to do it again,
and therefore the brain learns, and then after it brings you back to it again and again.
Exactly. Yeah.
Right. Okay. So does that inhibit a person consuming drugs, right, in any way, their judgment, their mental capacity?
Definitely, of course. Now, well, we know etomidate can lead to brain damage, right? In fact, there are some studies that say lead to permanent brain damage. Well, of cognition, in the frontal lobe is also important to make for judgment making, to make decisions, to do this or not, So when you are intoxicated with etomidate, so imagine your judgment is gone. You don't really know what you're doing actually, and your memory function is also affected. So a lot of things affected. So this can lead to dangerous actions, right? So we know of the news of the couple in a car that crashed into the bus.
Oh yes.
Yeah, one of the passengers, I think, that passed away, and they found to have all these substances, etomidate, KPODS. It can lead to a lot of unnecessary, harmful consequences. Yeah.
Does it affect them to the extent where they are unable to rationally consider consequences, and to the extent also where they feel that all solutions are beyond them anymore, and they get depressed, even get anxious, and even like suicide considerations, ideation?
Yeah, of course. I think etomidate can lead to severe mental disturbances, right? Can lead to especially depression, right? Can lead to anxiety, can lead to psychosis. So all this disturbed mental state can cause you to even develop some kind of self-harm ideas, or maybe even suicidal ideas, thinking that you can't get out of this situation. Yeah, it can cause a lot of effects. But sometimes it just leads you to doing things without knowing actually what you're doing. So with I do have some clients I've met, that they, after inhaling, they are not sure what they're doing. Some of them were found next to the window. They're in a dissociated state. They're not sure where they are. Some of them are so down with their life, and etomidate enhances their suicide thoughts. So it can lead to a lot of all these unnecessary mental effects.
You mentioned, Doc, that it's actually an anesthesia.
Yeah.
So help us to appreciate this a little bit more in the context of, like, if you go to operation, it's very measured, right? Okay, imagine this is like, wow, you're just taking it very casually, right? Just give us an understanding of how this plays out.
So if you go to the hospital, you have an operation, the anesthetist will give you a measured amount of etomidate, safe for you, right? Safe for your
And they will
use.
know us what we need, right?
Yeah, they will know. Definitely, they won't overdose you. Enough for you to go under, with the operation going on safely. So it's safe, right? So it's with research and all this, to inform us what is a safe dosage. But if you are vaping, how do you know how much you're vaping? You may be vaping 1, 2, 3, so many times a day, and you do not know how much goes into that one vape. How much the manufacturer inject or use etomidate into the liquid or vape, So you're essentially like playing Russian roulette. Yeah. Every time you vape, it's either a small bullet or big bullet, but you still get a bullet.
Oh my
You
goodness.
still harm your body, harm your brain.
Yes, yes. And if in a medical setting, if you measure too much, you can harm the patient, right?
I mean, of course, in general medicine, that's why we have approved recommended
That's right,
dosage. Yeah,
that's
what
right.
is needed for this condition or
That's
use.
right.
Yeah.
So therefore, it's safe in a medical
safe.
setting because we know what's recommended.
Yep.
But I guess I'm just hypothetically speaking, right? That's to play out the worst case scenario. If it's used too much, right, then the patient can die effectively, right, on the
Of
table.
course, yeah.
For sure, right? So can you imagine now out there, we are actually consuming this, and we like the Russian roulette. Sometimes it's like heavily dosed, right, and some is like very laced only.
Yeah.
You have
So,
no idea.
so I mean, you look at those stories of people behaving like zombies.
Yes.
Can you imagine the effect of the etomidate on the brain? Yeah, it's already affecting it. That's too much. Intoxicated. Yeah. Yeah. So
yeah, I think that explains why some of those videos that are out there, like streaming out there right now, you see people really out in the days. They have no idea what they're doing. They have no control over their body.
they have no control. They have involuntary spasms.
That's right.
They walk
Shivering, some of
unsteadily.
them. Yes, yes.
They really look like zombies in the movies.
Yes.
Yeah, the way they behave, they walk.
That's right. That's right. And I'll be interested now also to share with everyone about the relationship that will be affected. And I can imagine it will be a tense time for all family members. When one of the family members actually, dabbling with the drugs or even consuming it, maybe even to the extent where they're using so often already, and it's already rewired the brain. Are you going through stress? And what kind of stress are you actually experiencing? Are you getting any help? Right, and this is where we are interested to now talk about the relationship. Right, we've heard all the medical understanding of etomidate and all the drug lace in vapes. Right, let's talk a little bit now about the relationship. Right, any experience from your work about families talking about the difficulty in reaching out to members, right, who are very into K-pop, but the lace, especially with drugs, and now it's very difficult, and the relationship gets very tense, right?
Very tense. Yeah. Very tense. I mean, I see this not just in K-pop or etomidate. In general, substance abuse. Substance abuse, even alcohol. But lately, I think over the last 2 years, 3 years, I've seen parents, coming to me to ask me what to do with their kids. They are found to have vaping devices. They're found to be vaping, and when I talk to the kids, they will tell you, they usually underreport. Yeah. But some of them will say that, I'll hide from my mom and dad when I do it. I'll go to the stairwell and do it. They won't be able to find where this stuff are. So it's always this cat and mouse game.
Yes.
Parents want to find the devices, find the vaping stuff, but the kids are hiding them, or getting them again. It creates a lot of tension, and you can see the parents are feeling helpless. They don't really know what to do. A lot of stress, that they have to.
Yeah. So I wanted to highlight you mentioned to be safe as well. So if you reach out to your child, or even your young adult child, about the vaping and the drug taking, I think you want to be careful in not intervening when your child is high and seemingly aggressive. And I think that's very important, right?
Very important. No point. You're hitting the wall.
Yes, that's right. Yeah, because if they are not thinking straight because they are already influenced by the drug.
They can't comprehend what you're talking. So, so do this when they are sober. Yeah, when they're calm, you know, when the drug is out of the system.
Yeah. So leave them alone for the time being?
Well, I mean, when they're intoxicated, when they're high, of course, you have to ensure the safety.
That's right.
Yeah. But always find a good time to talk to the child.
Yes.
Yeah.
Yes.
But I think for start, parents need to know and have some knowledge first. Educate themselves about what is KPOD.
Yes.
You know, what are the effects of etomidate, how dangerous it can be, you know, what are the effects. And also, I find parents, it'll be important for them to understand addiction as a brain disease, right? It's not moral failing, right? It's not because of their character. You know. Well, the effects of this etomidate has caused them to be like that, you know. And also just know some of the legal landscape too. You know, what are the new laws or the things surrounding the etomidate? Like it's going to be considered under Class C of the Misuse of Drugs Act. And I talked about safety earlier. Ensure the safety, right? Removing any KPODs you can find at home as much as you can. Removing any triggers, and finding a time, you know, finding a time to talk to the child. Of course, when they are sober, when they have not inhaled the vape. I find it's important to try to maintain a calm tone, right? Avoid confrontation. Yeah, no point. You know, confrontation, yelling, lecturing, just push your child further away.
That's right.
Right. You want them to come close to you, right? And show concern. Show concern. Show love. You know, you just want to foster a supportive environment for them to open up to you, right? To be able to tell you what's going on, why they are using it, how they get it. You know, want all this information as much as you can.
Yeah. So first instance is to be safe, and if they are already influenced, right, intoxicated already, just keep them safe within the room or within the household, so they just loiter around, you know, in public or in the neighborhood, until the whole drug wears off, and hopefully by the time you are able to have that conversation with your child, the younger they are, the more understanding you need to extend to your child and to have that conversation with them, so that they hear your concerns and they will be able to be ready to listen to any advice. The older they are, I think advice maybe not so welcoming, right? Is that your experience?
Yeah, they take it as nagging, right?
Nagging, right?
Nagging, and you know, you just push them away.
Yes.
So as long as you keep maintaining this show of concern for your love, it's important, and tell them how it's affecting them, not just them, but the family, affecting everyone. So you need to let the child know that it's not just because you're irresponsible. So don't use tone like that. But it shows that you're worried about them. I'm worried that you're skipping school. Right? I'm worried that you're behaving like a zombie, you know, walking around like a zombie. I'm so worried that the kind of actions that you can cause harm or hurt to the family or even people around you, you know, things like that. To let them understand that vaping is not just simply just feeling good, but it has a lot of bad effects, you know, affecting people around you.
Right.
And also for family, for parents, don't enable the child. Don't enable when they harass you for money to buy vapes, right? Give them money just because they harass you, right? Don't make excuses for their behavior, right? So like for example, or shield them from consequences. So I heard of a child, you know, caught vaping, and then the parents told the teacher, you know, just a simple vape, but what's the big deal? You know, don't shield them away from all this to enable their behavior.
Right.
Yeah, very important.
It is, yeah. Because they learn, right, from your example and what you say to them, right? And because you are their parent, so obviously, you know, they will consider what you say, especially giving in to them, right? So that sends a signal. Yeah. is there any way we can prevent this from even starting?
I think it goes all the way back to your relationship with your child.
Yeah.
It's so important, you know.
Yeah.
You have a trusting relationship. It allows you to impart good values to your child. It also allows your child to be able to share with you anything that goes on in his or her life. And if there's any chance that the child go out of line, you know, you're able to approach your child and talk to him or her openly. You know, without this trusting relationship from the start, it's very, very hard, I find, you know, to be able to breach any gap and then help them. Yeah.
I know for some of your parents, yeah, it may be a bit too late, you feel, and probably your child is already, you know, consuming the laced K-pod, right? They're already using it, right? I guess don't lose hope. Reach out to professionals. That's important, and then we'll be able to support you. Reach out to us, and we'll be able to support you. And don't keep it to yourself. I guess most immediately also gather your family members whom you can confide in, or friends you can confide in, and to be able to get some support, right? Emotionally and psychologically, right? That's obviously the first you know point of support that you can actually gather, right? And after that, the professional ones as well. Yeah. So this is our attempt to really inform you all from the medical point of view, and also from the psychosocial point of view, and how it can actually cause stress to you and affect you emotionally. I know it can be hard for some of you because it's your loved ones, right? So we are here to support, and hopefully this information is useful for you all. Anything to add, Doctor?
Well, I think I'm just thinking as we are talking about K-pod, we want to leave two very important messages.
Yes.
Right. For the user, for the family members, right? And these two messages are encapsulated in the acronym KPOD. Yeah. So we better talk about the dangers first. So the dangers, K for knock you out. So basically, Etomidate, K-pod, knock you out. Basically, knock you out. Yeah. You don't know what's going on, right? P for paralyzing you, right? There's this effect of paralyzing not just physically, your mental state, your life too. Correct? Yeah. O for opportunities gone or destroyed. You know, your education, your career, your social life, your relationship, it all will be affected to some extent, right? And then D for death. That's the ultimate harmful consequence, right? Death. So it can be something that is very, very avoidable. But you know, these are not just to scare you, not scare tactics, but they are very real documented effects. But there's hope, you know, there's hope. If you know, or anyone you know is suffering from or struggling with vaping, Etomidate use, this is what you can do. It's another KPOD, all right? K for knock it out. So kick the habit, right? Just kick it away. And P for pick health, right? Treasure your health, treasure your body, treasure your brain, your lungs, your kidneys, your adrenal glands, whatever. Your good health to start with. Why destroy it? Correct, right? O for open up, right? So just talk to someone that you trust, talk to someone that you know who can help you. So it could be your family member, could be your favorite, you know, family doctor or GP, could be your teacher, you know, someone you meet in school, or your school counselor, or a friend, you know, or a helpline. Just talk to someone, you know, open up. And then lastly, D for do it now, right? Don't wait, don't hesitate, just do it now. As soon as you quit this, you know, you are more likely to get your health back.
Yeah. Wow.
Yeah.
How relevant it is, right, using K-pop, right, to watch out for how it can impact you, and also how you can, I guess, save yourself, and parents to save your child. So once again, thank you for tuning in to us. Thank you, Doctor.
Thank you.
And we really appreciate your time here, and we'll do our part continuously to provide information to support you and your family. Thank you very much.
Thank you.